Hello. My name is Jones, and today we are going to look at Introduction to Surgery and Surgical Nursing. Surgery is a medical specialty that uses operative manual and instrument techniques on a patient to investigate or treat a pathological condition such as a disease or an injury, or to help improve bodily function or appearance, or sometimes it can be done for other reasons. So surgery is a medical specialty in which operating manual and instrument techniques are used for diagnostic and treatment purposes. An act of performing surgery may be called a surgical procedure, operation, or simply surgery. In this context, the verb operating means performing surgery. All forms of surgery are considered invasive procedures. So now, by definition, we are saying surgery is the art and science of treating diseases, injuries, and deformities using operative procedures. The principles of surgery include preserving life, to alleviate suffering, to limit and repair damaged tissues, and to relieve symptoms. So these are the principles of surgery. Okay, remember, we are saying surgery is art and science of treating diseases, okay, through operative procedures. So these operative procedures are done under the principles of preserving life, to alleviate suffering, to limit and repair damaged tissues, and to relieve symptoms. Okay, so now let us appreciate some conditions that require surgery. So conditions that require surgery include obstructive or blockage conditions. It includes conditions that have to do with perforation, conditions that have to do with erosions, okay, and also conditions that have to do with tumors. So when you're talking about obstruction or blockage conditions, these conditions mostly affect the arteries, for example, coronary and cerebral arteries, which may need to be unblocked or bypassed. Okay, so then we also have surgery that may involve tubes to do with obstruction. Here we are looking at ureters, which may be blocked either by stones or tumors, and also intestines that can also be blocked. So these need to be unblocked in order to establish the passage of waste. When you're talking about the intestine, if there's a blockage, it needs to be unblocked in order to allow passage of waste. Okay, so under obstruction or to do with blockage condition, we have looked at blockage of arteries, blockage of tubes like ureters or intestine. Then other condition requiring surgery is perforations. So this has to do with the rupture of an organ, artery, or a vein. Okay, the example I can give here is a perforation of the bladder or lungs. So these need to be repaired in order to maintain the principle of surgery, which is that of preserving life. Okay, so then the third condition requiring surgery has to do with erosions. Okay, so on erosions, what I can say is that the wearing or eating away of the tissue as a result of a continuous physical irritation, inflammation, or ulceration may necessitate surgery. Example I can give is peptic ulcers. The process of erosion will wear away the tissue, okay, that is covering the stomach and result in peptic ulcers. And there will be bleeding, okay, and also the ulceration may threaten or become cancer, may threaten in becoming cancer or cancerous. So surgery may need to be done. Okay, so erosions, the best example that we can look at is peptic ulcer, where there is erosion of the gastric lining. Okay, the fourth condition requiring surgery is tumors. Okay, so it's tumors. So these are overgrowths of tissues that form masses, forming no physiological function in the body. Tumors may be malignant or benign. Okay, if you're good at poetry, we are looking at POET. Okay, as some conditions that require surgery. Okay, that is P for perforation, O for obstructive conditions, E for erosions, and T for tumors. So poetry. So POET. That is to do with conditions that require surgery. So under these, then you can look for examples to do with perforation. Okay, perforated peptic ulcer, it requires surgery. Obstruction, okay, you can look at coronary artery blockage, where you might need to do a bypass. Tumors, there are a lot of examples to do with tumor, brain tumors, and the likes, where you might need to do surgery. So condition requiring surgery may fall under these major headings. Okay, that is to do with obstruction or blockage, perforation, erosion, and tumors. Okay, so I think that would help as to the many reasons as to why surgery is done. Most of the conditions, or I would say most of the conditions in which surgery is done, it has to do with tumors, erosions, perforation, obstruction, or blockage. But when we come to appreciate the types of surgery, you'll find that these might not be the reasons for conducting surgery, because cosmetic reasons may come in for reason of doing surgery. So we have just simplified the poet here, okay, as P or ET, to look at just these four main conditions that may lead to surgery. But when you look at other types of surgery, we will appreciate other reasons for surgery. Okay, when you look at the organ transplant, where you're bringing in, okay, there might have been a disease with that organ, and then you bring in a new organ. So it may be a tumor, and then you bring in, or the diseased body part that you want to remove in, and the only solution is surgery. Okay, so now let's appreciate some terminologies that are used in surgery. Here I'm just going to look at a few, but you can always explore for more. Okay, so the terminologies that I'm going to look at here include anastomosis, ectomy, resection, ostomy, otomy, and fistula. Okay, so these are the terms that we are going just to appreciate. But otherwise, here it is important you appreciate the etymology of most surgical terms. Okay, when you look at a lot of them, you're going to appreciate some of these words, how they necessarily come about. So when you say anastomosis, it means end to end, side to side, or side to end union of a hollow tubular organ. So to anastomose is to bring together. Okay, to bring together, okay, something that is in union. So now here you're looking at tubular hollow organs that we are bringing together. So anastomosis is end to end, side to side, or side to end union. To anastomose, bringing together. Okay, so bringing together to union, that is hollow tubular organs. Then ectomy, or ectomy starting with E, ectomy, that is removal of an organ. Okay, that is removal of an organ. Ectomy, removing an organ. Then resection, is removal of a part of an organ. Okay, to resect, a sect, okay, a section. So resection is removal of part of an organ. Then ostomy is a procedure for formation of a permanent or semi-permanent opening called a stoma in the body. That is in the body end, like we have colostomy, tracheostomy. Okay, it's ending with ostomy. Okay, so here in this procedure, there's formation of a permanent or semi-permanent opening. Then there is otomy, starting with O, otomy, then T. Okay, then the previous word is ostomy, that is with A, that is OS, then TOMY. Then otomy, S there eliminated. It's otomy, that is opening into an organ. Okay, so opening into an organ. Okay, so we try to appreciate these words because of necessarily what they mean and for the clinical implication of it. Ostomy, here you are forming a stoma or a hole, but when you say otomy, you are opening into an organ. Okay, then fistula. Okay, it's a term that is used in surgery to imply an abnormal connection between two organs or cavity, and this can be with the surface of the body. So, example of fistulas, we have rectovaginal fistula as one of the example, and it can be broken down into different types. Okay, to do with fistula. So, fistula is an abnormal connection or communication between two organs or cavity and the surface of the body. Okay, so those are the few terminologies that we are looking at within this discussion. You can explore for more in order to understand surgery in nursing. Okay, so we just picked out these few. Then classification of surgical procedure. Okay, so surgical procedures are classified on the basis of urgency, degree of risk of surgery, and the purpose of surgery. Okay, so the main classification when we're talking about surgery, okay, it is based on the urgency, how urgent the surgery is needed. Then the degree of risk of surgery. Then apart from that, the purpose of surgery. Okay, so now, with what we have just said here, we are going to look at these separately, necessarily what it means when we say based on urgency. So basing on urgency, surgery may be classified as elective surgery, urgent surgery, or emergency surgery. Okay, so based on urgency, we are looking at three types of surgery. That is elective, urgent, okay, urgent and emergency surgery. So now, when we say elective surgery, it is pre-planned and performed on the basis of client's choice. It is not essential and may not be necessary for health, and delay in surgery has no ill effects. Can be scheduled in advance based on the choice of the client. The purpose of elective surgery is to remove or repair a body part, or to restore function, or to improve health. It can also be done to improve self-concept. Okay, that is to do with elective surgery. For example, when you're talking about tonsillectomy, hernia repair, cataract extraction and lens implant, or hip prosthesis, hemorrhoidectomy, okay, these can fall under elective surgery. Okay, so the other thing also you need to know about elective surgery is that it is usually subdivided into three categories. So elective surgery can either be required, selective or optional. Okay, so elective surgery, this same elective surgery that we are discussing under based on agency, it can either be required, okay, selective or optional. So required surgery here, we are looking at physical ailments that are serious enough to need collective surgery, but that can be scheduled a matter of weeks or months in advance. Generally, they are designated as required surgery cases. Conditions such as chronically inflamed gallbladder, cataracts, bone deformities, or diseased tonsils and adenoids would be example of conditions that require surgery. So that is on required surgery. Then when you say selective surgery, okay, so selective surgery covers a broad range of conditions that are of no real threat to the immediate physical health of the patient, but nevertheless should be corrected by surgery in order to improve the comfort of the patient and also their emotional health. Certain congenital defects such as cleft lip and cleft palate would be included in this classification of selective surgery, as well as the removal of certain cysts and non-malignant fatty or fibrous tumors. Okay, so these may fall under selective surgery. Okay, then we have optional surgery. Okay, so this one is of the lowest priority, okay, type of surgery. Okay, operations that are primarily of cosmetic benefit, such as removal of warts and other non-malignant growths on the skin, blemishes of the skin, and certain cases of varicose veins. Optional surgery also includes various kinds of plastic surgery undertaken for cosmetic effects. Among popular types of plastic surgery are operation to reduce or enlarge the shape of female breasts, reshape the nose, correct protruding ears, remove bags, okay, that is under the ears, or decrease facial wrinkles. So these are optional surgery. So required surgery, selective surgery, and optional surgery for surgery based on the agency. Okay, so now when you talk about agent surgery, okay, as a type of surgery based on agency, okay, this is a type of surgery in which the surgery is the necessity for the client's health but not an emergency. Okay, that is agent surgery. So we are looking at a procedure or a surgical procedure in which surgery is a necessity for client's health but not an emergency. It is performed for the purpose or purposes as in elective surgery and to prevent further tissue damage. For example, let's say removal of gallbladder, coronary artery bypass, or surgical removal of tumors. These may fall under surgery. Okay, so other authors may look at these types of surgery in terms of hours. That may be it's a type of surgery that you might need to do within 24 hours or within a short period of time. So others, they try to look at it, but in other presentations that can still be added. For now, we're saying agent surgery. That is a surgery in which the necessity for client's health is taken, but not that the surgery is an emergency. It is performed for the purpose as in selective surgery and to prevent further tissue damage. Then we have emergency surgery. So when surgery must be done immediately, Okay, that is emergency surgery. When surgery must be done immediately to preserve the client's life, remove or repair body parts, restore function, improve health and self-concept, then we are calling this emergency surgery. Surgery that should be done immediately. For example, control of hemorrhage. This requires immediate surgery, or it requires, this is an emergency surgery. Okay, looking at also other surgery to do with repair of trauma or perforated ulcer or intestinal obstruction, tracheostomy, and even cesarean section. Okay, in obstetrics, this is an emergency surgery. So it's an emergency surgery. Okay, surgery that needs to be done immediately. Okay, so we are looking at classification of surgery. We have just looked at the a type of surgery, the first classification of surgery, which is based on agency. So this type of surgery based on agency here, we have looked at elective surgery, and we have mentioned that elective surgery can be further broken down to required surgery, selective surgery, or optional surgery. Then other types of surgery based on agency, we have said there's urgent surgery and there's emergency surgery. So under surgery based on emergency, the three main types of surgery is elective surgery, urgent surgery, and emergency surgery. Now let's look at classification of surgery based on degree of risk or seriousness of surgery. Okay, as the second part. So we are looking at classification of surgery based on degree of risk or seriousness of the surgery. So surgery has been classified as a major or minor on the basis of the risk on the client. Okay, so when you're looking at surgery based on the degree here and risk, here we're saying it can be classified as either major or minor based on the risk to the client. So when we say major surgery, it involves extensive reconstruction or alteration in a body parts. Okay, and the surgery poses great risks to well-being of the patient. It requires hospitalization, usually for a prolonged time, and it involves major body organs. This type of surgery, when say major surgery, it is a life-threatening type of surgery. Okay, and there is potential post-operative complications that may arise. Major surgery may be either elective, urgent, or emergency. For example, when you talk about nephrectomy, cholecystectomy, colostomy, and hysterectomy, these may fall under major surgery. Okay, because of the risk that it poses to the well-being of the patient, there is increased risk of complication. Okay, that is, it is fitting within major surgery. Then there is a minor surgery. It is primarily elective, and it is usually brief, carries low risk, and results in few complications. It can be performed in clinics, outpatient clinics, and minor operation theaters. For example, we can look at teeth extraction, removal of warts, skin biopsy, laparoscopy, dilatation, and curettage. These are minor surgery. They pose low risk for complication. They pose low risk for prolonged hospitalization. Okay, so now we can look at the other type of surgery, okay, which is the third one on the classification of surgery. And this type of surgery is based on purpose of surgery. Okay, so the third type of classification of surgery, it is based on the purpose of surgery. So surgical procedures are based on purpose will include diagnostic, ablative, palliative, reconstructive, transplant, or constructive. Okay, so these are types of surgery that are based on purpose. So we have diagnostic, ablative, palliative, reconstructive, transparent, and constructive surgery. Okay, so now when you have this first type of surgery which is based on purpose, that is diagnostic, it is a surgical exploration that allows physicians to make or to confirm diagnosis. May involve removal of tissue for further diagnostic testing. For example, breast biopsy, laparoscopy, bronchoscopy, exploratory laparotomy, that is incision within the peritoneal cavity to inspect abdominal organs. So these fall under diagnostic surgery. Then we have ablative surgery, which is an excision or removal of diseased body parts. Example is appendectomy, subtotal thyroidectomy, partial gastrectomy, or colon resection, and even amputation. It falls under ablative types of surgery. Okay, so we are looking at surgery based on purpose. Okay, and then we have palliative surgery. This is surgery that is performed to relieve or reduce intensity of an illness or disease symptoms. This type of surgery, please, you have to know that it will not produce cure. For example, colostomy, debridement of necrotic tissue may fall under palliative surgery. Then we have reconstructive surgery. It is performed to restore function to traumatized or malfunctioning tissue and to improve self-concept. Reconstruction. Okay? So, for example, you can look at scar revision, plastic surgery, skin grafts, internal fixation of fractures, or even breast reconstruction. These may fall under reconstructive surgery. Okay, performed to restore function to traumatized or malfunctioning tissue and also improve self-concept. So when you're looking at breast reconstruction and plastic surgery, these are done necessarily to improve breast self-concept, Okay. If one had a scar, they might need a revision of that scar. It will help improve self-concept. Then we have transplant. It is performed to replace organs or structures that are diseased or malfunctioning. For example, kidneys, cornea, liver, heart, joints, or total hip replacement may fall under transplant surgery. Okay? Then we also have constructive surgery. Okay, constructive surgery is performed to restore function lost or reduced as a result of congenital anomalies. Okay, here we are looking at repair of cleft palate or closure of arterial defect in the heart. So these may fall under constructive surgery. Okay, so the three types of surgery that we have looked at here, we have said we have surgery based on urgency. Okay, then we have surgery based on purpose or the serious or the risk. Okay, that is surgery based on the risk or the seriousness of surgery. Then we have surgery based on the purpose. Okay, so you can see that under this we have different types of surgeries that may fall within this, and we need to appreciate all these types of surgery for what they mean and their clinical significance. Okay, so with that discussed, let us look at some of the effects of surgery on the patient or upon the patient. When a patient undergoes through surgery, their body will go under some kind of stress. Okay, any surgery, even minor, it can be major, but the body passes through some kind of stress. Okay, it can be psychological, okay, stress that may face, or physiological stress. Okay, it's because of the intensity and the preparation that is required for surgery. Then the other effect of surgery on the patient is that to do with immunity, which is likely to be lowered. Then the other effect is a disruption in the vascular system, or interruption within the vascular system, because there is cutting, okay, which will affect the blood flow or vascular supply. Then the other effect that surgery has, it has to do with organ function. Okay, apart from that, surgery also bears the effect of altered or disfigured body image that you need to be wary of. Okay, so the effects of surgery upon the patient, here we are saying stress. The stress response is stimulated or elicited, okay, because of, okay, is because of surgery. Anticipatory agents leads to fear and anxiety for clients who associate surgery with pain or possible disfigurement, dependence, or perhaps even loss of life. Family members often fear a disruption in lifestyle and experience a sense of powerlessness as the day for surgery approaches. So these are some of the things or the reasons as to why the clients who is about to undergo surgery may feel some stress. So the patient who have some stress, and also the family who have the stress. Please don't worry, I haven't talked about also the financial stress that may also couple this because of disruption of achievement of activities of daily living. So there is also some financial stress because you might need to cough a lot of money in order for the surgery to be conducted without problems. Okay, the other effect of surgery upon the patient has to do with immunity. Okay, so defense against disease is lowered, and cutting through the skin is that when you cut through the skin, it removes the barrier that the body has against the infection. Remember, the skin plays a role in face the defense against the infection from the outside world. So when you cut, you compromise the skin's integrity, hence posing a risk of infection. Okay, so patient becomes prone to infection when you cut them, okay, because there's compromised skin integrity. Then there's vascular system which is interrupted. Okay, so this also has to be looked at as the effect of surgery upon the patient. Blood vessels are cut and the patient may bleed. Okay, so the blood vessels have been disrupted, or they have been interrupted in their supply of blood, okay, to nourish the organs that are within those areas. So vascular system is interrupted. Then the organ functions. Okay, the organ function here we're saying it's going to be disturbed because, as we have stated earlier, interrupted vascular system, okay, which supply blood to these areas, and blood carries with it nourishment and other immune components. So too much also handling of intestine may predispose to paralytic areas, or may lead to paralytic areas. And if a client develops paralytic areas, it may lead to intestinal obstruction. Okay, then there is body image which is disfigured. Remember, when you're talking about surgery, it involves cutting. And if you cut any part of the body, it will affect self-concept. So here we are saying the body image is going to be disfigured, as there will be evisceration. Okay, imagine someone is having mastectomy, So the body image here becomes disfigured. Okay, the scar formation after surgery, all that will cause problems to do with altered body image. Okay, so today we have been looking at introduction to surgery, okay, and surgery and surgical nursing. And when talking about introduction to surgery and surgical nursing, it's different and unique to nursing. Okay, it might not be the same as we might look at it to do with clinicians. Okay, so we said surgery is a medical specialty that uses operative manual and instrument techniques on a patient to investigate or treat a pathological condition. Okay, this pathological condition may come because of injury or may come because of trauma and other reasons. So the act of performing surgery is called surgical procedure. And then the word surgery also is used to mean act of performing surgery. So the verb operating, okay, means performing surgery. So if at all you find yourself using all these words, please don't feel guilty. It just means the same. It's going for an operation, it's going for surgery, okay, or it's having a surgical procedure. We just mean the same, the act of performing surgery. Okay, so all forms of surgery are considered invasive because it involves penetrating the skin, cutting of the skin, so they are considered to be invasive. Okay, so all forms of surgery are considered to be that. So we also defined surgery within our presentation, and we said it is the art and science of diagnosis and treatment using operating procedures. Okay, so in definition of medicine, we said in definition of medicine we say it is the science of diagnosing and treating. You get it, huh? Okay, diagnosing and treating, that is medical condition. But here we are using operating procedure within this art and science in order to repair or to come up with the diagnosis. So the principles as to why surgery has to be performed, the principles that are there necessitating for surgery, it's to preserve life, to alleviate suffering, to limit and repair damaged tissue, and to relieve symptoms. So when you are writing your aims in surgery or before you write your nursing care, all the surgeries will follow these same principles. The aims of surgery will be to preserve life, to alleviate suffering, limit and repair damaged tissue, and relieve symptoms. So this can help you in coming up with your aims for any type of surgery. Okay, so then we looked at conditions requiring surgery, and here we looked at the POET, that is P, perforation, O, obstruction, E, erosions, and tumors to be conditions that require surgery. Please remember, this is just for this presentation. There can be other conditions that require surgery, but within this angle of our presentation, we're looking at these as the main factors that may lead to surgery or a condition requiring surgery. Then we looked at some terminologies that are used in surgery. We looked at a few, but there are a lot of terminologies that are used in surgery. And for you to appreciate surgery, you need to know how most of these terminologies come about. Then you can have all those big, long words, but you be able to break them down to know where it is coming, where those words are coming from. You have to examine the roots, the suffixes, okay, the prefix of those words in order for you to appreciate what that word means, okay, in surgery. Then we looked at classification of surgical procedures. Under the classification of surgical procedure, we said Surgery can be classified on the basis of urgency. Surgery can be classified on the basis of risk of that surgery. And then we said surgery can be classified on the basis of the purpose of that surgery. So based on urgency, we looked at elective surgery. And under elective surgery, there is required surgery, selective surgery, optional surgery. Then under surgery based on urgency, we have said that there is also urgent surgery. So urgent surgery is a surgery that should be done within a short period of time, short period of time in order to save the patient's health and also reduce on the damage. But when you say emergency surgery, it has to be done immediately. Okay, so now surgery based on the risk and seriousness. Here we have two, major and minor. Okay, so under major, we say it involves extensive reconstruction, may require long-time hospitalization, poses high risk of complication. Minor surgery, we have said it's primarily elective and usually brief. Okay, may be done in simple settings within the hospital where this surgery can be done. Then surgery based on the purpose. We have said there's diagnostic surgery. Under surgery based on purpose, there's ablative, palliative, reconstructive surgery, transplant, and constructive surgery. After this, then we looked at the effect of surgery upon the patient. So when you appreciate the effect that surgery has, to help you to have an understanding of what necessarily the patient's potential risks that they may have. So we're saying the stress, patient's body becomes stressed, and the immunity becomes lowered. Vascular system becomes interrupted. The organ function, it becomes disturbed. Okay? And then the issue of body image, which is disfigured because of surgery. So please watch out for the next part where we'll look at management of patient undergoing surgery. And I urge you to follow our lesson part by part. If at all you have listened, let's say you have listened to part 1, then you can go to part 2. Then you are going to appreciate well the foundation that we are laying in understanding surgery. So from me, I'm saying thank you and keep studying.